Mauioni chimpya yokuti siningazi chingilize ngati pali chintu chuvalisha ni mauioni chimpya nunkalila kuziuja imbani mozako bakumvwe ulavila usankale na mwezo mumtima wako zimbishe nyimbo zako imbani nyimbo zako bakumbwe ulavila usankale na mwezo mumtima wako zimbishe nyimbo zako ayakine onikonda komasoni langija nukonda bantu onse siwose wonikonda ine sonipasa ntawi yobalangija mutima wangu ne ayakine onikonda komasoni langija nukonda bantu onse siwose wonikonda ine sonipasa kona ntawi yobalangija mutima wangu ne nukalila kuziuja imbani.
Hello, everyone, and welcome to today's webinar on exploring the impact of women's leadership in reproductive, maternal, newborn, child, adolescent health and nutrition, and immunization. My name is Rosemary Morgan, and I am an associate research professor at Johns Hopkins Bloomberg School of Public Health. And along with Dr. Anna Kobarczyk, we co-PI this particular study and are very delighted to be able to launch it here with you today. Next slide, please. So just a few housekeeping points before we begin. Please do introduce yourself in the chat. Feel free to share why you are interested in women's leadership and your LinkedIn profile. We'd love to be able to connect with everybody here on that platform. If you have a question, please do use the Q&A feature to ask questions, not the chat box, because that will really help us to monitor those. And we will have some time at the end of the session to address that. So we have the option today for you. You're able to turn on the English language captions or translated captions in the toolbar. So by what we mean by that is that you can turn on captions in any language. So what you need to do is click on the Show Captions button. You'll see a toggle, a button you need to press to make blue next to translations. And then you want to make sure that you change the caption language, not the speaking language, but the caption language to your preferred language of choice. And you can do French, Portuguese, Thai, any language of your preference. Next slide. So here is an agenda for the next hour. I am going to start us off with a very short introduction to the study. Then we are going to hand it over to Charlotte Pram-Nielsen and Sofia de Almeida to talk about the importance of women's leadership to the Global Financing Facility and Gavi, the Vaccine Alliance. Next, I'm going to hand it over to Anna Kobarczyk, who is going to provide an overview of some scoping review results that we have conducted that really look at ways in which women leaders have had an impact across sectors. Then we're going to hand it over to our colleagues, Melanto Rabari, Cholwe Jacobs, and Swalia Abdulkadir to talk about some reflections from Madagascar, Zambia, and Ethiopia. We will end today with a quick call to action and then have a question and answer session. Next slide, please. I'm going to very briefly introduce our panelists today. You can see all of their photos on the screen there. So we have Dr. Cholwe Jacobs, who is the co-founder of Women in Global Health Zambia chapter and a lecturer at the University of Zambia. We have Dr. Anna Kobarczyk, who's a study co-PI and an associate scientist at Johns Hopkins Bloomberg School of Public Health. There is me, Dr. Rosemary Morgan, who's a study co-PI, associate research professor at Johns Hopkins Bloomberg School of Public Health. We have Swalia Abdul Kadir, who's the project lead at International Institute for Primary Healthcare Ethiopia. We have Melanto Rabberry, senior consultant specializing in RMNCAH-N in Madagascar. We have Charlotte Pram-Nielsen, who's a senior health specialist in sexual reproductive health and rights and gender at the Global Financing Facility. And we have Dr. Sofia D. Almeida, who's the Gender Zero Dose and Demand SFA Coordinator, Gavi, the Vaccine Alliance. Next slide. So why are we here today? We're here today because basically the state of women's leadership in global health, that women make up 70% of the healthcare workforce, 90% of nursing and midwifery roles, but only 25% of leadership positions in the health sector. Yeah, and most of you should be aware of Sustainable Development Goal 5.5, which underscores the imperative to ensure women's full and equitable participation in leadership across all spheres of political, economic, and public life. And right now, women still do not have full and equitable participation across these spheres. So the reality is contrasting with our aspirations to have a more equitable distribution of women in leadership positions, as women continue to encounter disproportionate barriers to accessing decision-making roles, including lack of mentorship, gender biases, harassment, and gendered networks, institutions, and processes. Next slide, please. There are documented benefits of gender parity in leadership. I mean, there's documented benefits of diversity in leadership in all its forms, not just gender, but race and ethnicity and age. You know, women leaders particularly have shown to positively impact maternal and child health policies, strengthen health facilities, and reduce health inequities or inequalities in the health sector. So this project is funded by the Global Financing Facility, or GFF, and Gavi, and we're really seeking to move beyond the barriers that women leaders face. We believe that the barriers are well identified and documented of barriers women leaders face in entering leadership positions, and instead focus on the impact they've had in spite of them. So what impact are women leaders having? So we are really seeking to generate evidence on the impact of women leaders in organizations in low and middle income countries to hopefully support increased investment in women's leadership. We're doing this by exploring the impact specifically in the reproductive, maternal, newborn, child, adolescent health and nutrition, and immunization spaces more broadly at the global, national, subnational, community levels. We're particularly interested in supporting and encouraging organizational change and improving health outcomes by identifying, organizational and other factors which support women leaders having an impact, and explore how women leaders are generating enabling environments for future leaders. So as we know, women leaders are having an impact, but we do know that the environments, the organizations that they're in, can impact their ability to have an impact. So women leaders are leaders in general cannot have an impact unless they are within enabling environments. So we're also interested in thinking about what are those enabling environments and how can we encourage them to ensure women leaders are having effective impact. Next slide. I would now like to hand it over to our colleagues, Charlotte Nielsen and Sofia de Almeida, to talk a little bit more about the importance of women's leadership from the perspective of GFF and Gavi. So Charlotte, if I can hand it over to you to start us off.
Yeah, thanks, Rosemary. And hi, everyone. It's great to see so many people connected. A lot of people passionate about this, as passionate as we are. I think that's really wonderful. Maybe just a quick word on who we are, the Global Financing Facility. For those of you who don't know, we are a partnership that are hosted at the World Bank. We were initiated in 2015, and we work particularly in countries that has a high burden of maternal mortality, child and adolescent issues. So more within the health sector, but also how that influences gender equality overall. And maybe just a couple of words of why we are interested in women's leadership. We are obviously particularly interested in women's leadership in health. As Rosemary started out by saying, there's a huge imbalance of how many women actually work in the health workforce, is 70%. And then knowing there's only 25% of these women who actually gets to the senior positions and the decision-making bodies. And I think that as a specific actor and institution that works in the health sector, we obviously have a responsibility also look at how do we address some of these bottlenecks and some of these imbalances. At GFF, we work specifically with 36 countries currently, and we work a lot with the government. So it's also helping them address some of these issues in various ways by providing things like the study, providing the specific evidence that can start a policy dialogue on how to address some of this. And one thing that we could mention additionally is that we know the countries we work in, at least that there's only 1% of women from low and middle income countries who actually then get to the leadership position. So it's a very, very little percentage of women in the countries that we work in. So we at the GFF, we identified that as one of our key priorities. We have what we call our roadmap to advancing gender equality. And that has been identified as one of our priority areas. And then additionally, in our 5-year strategy, this is another issue that is prioritized. So it's high up on our agenda to make sure that we contribute to advancing this in the countries we work in. Thank you, Rosemary. I'll hand it over to Sophia.
Good afternoon and good morning to some of you. I'm really delighted to be here with you today in this important project. And also, thank you so much for all the attendees. I think we will have a few slides just to frame my brief presentation around gender policy. And why? Because gender policy is critical to Gavi 5.1 vision, leaving no one behind with immunization. Next slide, please. Since the policy was approved in Gavi, there has been significant progress in mainstreaming gender into Gavi's policies, processes, and investments, as well as starting to build gender awareness and capacity across the Alliance. The majority of new Gavi grants approved in Gavi 5.0 have some gender-responsive programming to meet the needs of caregivers and health workers. However, some challenges remain, such as lack of recognition of the impact of gender barriers on immunization coverage, limited technical capacity to assess gender barriers and design interventions, and inadequate availability of and use of data to inform programming and measure progress. And to address these gaps, Gavi is prioritizing the following 3 components. 1, increase understanding of Gavi stakeholders on how gender norms and responsibilities impact the effectiveness of immunization programming and build the skills and capacity to effectively respond. 2nd, invest in measurement in order to better track progress against core gender indicators. And 3rd, scale up country-level gender technical expertise to support the design, implementation, and monitoring of robust gender-responsive and transformative immunization programming. Next slide, please. And how has Gavi progressed in operationalizing the gender policy? Over the past years, the Secretariat and partners have worked together to systematically implement the new gender policy, recognizing this is a significant change journey for the Alliance. The Alliance is building a strong foundation for impactful programming grounded in 3 pillars. First, mainstreaming gender into strategies, policies, processes, and guidance. Second, strengthening innovation and learning, identifying and collating evidence of gender-responsive and transformative approaches and sharing with countries, as well as testing new evidence-based approach and starting to scale it up in new countries. And third, building the capacity and coordination of the Alliance. Some progress has been made towards the policy, advocating for women and girls' full and equal participation in decision-making related to health, programs, and well-being, particularly in the types of interventions included in applications. For example, some countries have included support to increase leadership opportunities for women in immunization in their applications. However, more efforts and systems are required to systematically ensure equal participation of women and girls in design and implementation of programs. The Alliance now has dedicated funding to evaluate, test, and scale innovative gender-responsive and transformative approaches, including the Gender Strategic Focus Area, the SFA, through which this project is also funded. Next slide, please. So as one of the important steps to contribute for this objective is the investment in the Women's Leadership Project, focused on assessing the impact of women leaders in reproductive, maternal, newborn, child, and adolescents' health and nutrition in sub-Saharan Africa, specifically in Ethiopia, Zambia, and Madagascar, that will be expanded to encompass leaders in the field of immunization. So through a qualitative and quantitative methods and case studies, we will be able to deep explore the role and impact of women leaders in immunization, which is an important contribution to achieve the goals based on the vision of leaving no one behind with immunization and grounded in key 3 pillars. We are really excited about this project and with this partnership with the GFF and Johns Hopkins University, and we look forward for the outcomes and contribution of this project to increase women's and girls' full and equal participation in decision-making related to health programs and well-being. Thank you very much.
Great, thank you, Sophia. I would now like to hand it over to Dr. Anna Kabarczyk.
Great, thank you so much. In this section, what we wanted to do was provide some of the initial results from the scoping review that we conducted of the peer-reviewed literature that was really designed to map evidence on the impact of women's leadership, particularly in low and middle income countries. Now, given the limited available literature in health specifically, our review yielded results that largely focused on other industries, but we were able to draw out the relevance for global health, which we'll talk about a bit here. Next slide. Our sample included 93 studies, which were included in the final review. Studies were mostly conducted in East Asia and the Pacific, as well as South Asia, particularly China, India, and Malaysia. The studies primarily assessed the effectiveness of women's leadership in corporations or the stock exchange, followed by financial sector, politics and government, healthcare, and development. So we really spanned quite a range of sectors in this research. And studies assessed leadership outcomes at many different levels, including within the board of directors, top management teams like CEOs, COOs, as well as political leaders, committees and committee leadership, as well as committee representation, managers, as well as business owners and key stakeholders. In the next few slides, we'll go over some of the key impact areas where we found women's leadership was having a measurable impact, and we'll talk about the summary of these types of impacts. And so the first major area, unsurprisingly, given the number of studies that were based in the financial sector, is on financial performance, risk, and stability. And overwhelmingly, studies found that that women's leadership can lead to financial performance improvement, including increased profitability, having more capital for investment, where organizations experience less financial distress, and also improved market performance. We also found that women leaders tend to take fewer risks and increase the stability of organizations. Then the next impact area is on innovation. And in a couple of key studies, we found that women leaders have increased innovation, which includes both product and process innovation. So in the design of products, but also innovation in the processes in which organizations complete their business. And then the third area was engagement with ethical initiatives. So broadly, we might think about this as corporate social responsibility for private industry, but generally found that women's leadership led to increased engagement with corporate social responsibility and other initiatives that focused on the environment and also on disaster response. In health, while there were only a few studies that focused on health, those studies all found positive impacts of women's leadership, and this included greater food availability and accessibility, a reduction in sex-selective abortions, and a decrease in COVID-19 infection rates and mortality. So all of the health studies found positive impacts of women's leadership. Organizational outcomes, we broadly categorize these into things like employee retention, motivation, stimulation, and found that women's leadership can lead to increased retention, et cetera, including team cohesion and communication. And then women leaders also have influence on other women's careers and aspirations. And so that can mean having more overall representation of women within these organizations, also having increased representation of women with political candidacy, and increased aspirations of parents on daughters and on girls' educational attainment, as well as their use of time. So that's really aspirations around young girls reducing their time spent on domestic chores and increasing time spent on other things. And so you can see that across this literature review, we were really looking at all of these different types of impacts and then able to categorize them in these different ways. Next slide. So this slide then really tries to quantify where we saw positive outcomes measured and negative outcomes measured, recognizing that some studies found mixed results. And what we think is pretty clear is that overwhelmingly, women can have positive impacts on all of these different types of outcomes when they are in leadership roles. Next slide. So just to reiterate, in all sectors, across leadership roles, and across geographies, women's leadership can produce positive results. But what's less clear from these studies is why women leaders are having this impact, particularly when we know the many barriers that women leaders face, including overt and covert biases, discrimination, harassment, and patriarchal norms embedded in organizations and systems. And what we also found in the review is that where women leaders experience negative results, authors also describe unsupportive organizational and societal structures. And so it's very clear that when women were struggling to achieve the type of impact that they wanted within their leadership, there were other factors at play that largely included these unsupportive or patriarchal organizations. Next slide. Another key finding was that women leaders' success can really not be separated from the environments in which they work. It's not just about increasing representation of women leaders, but really about creating environments that support women leaders to succeed and have this wide range of positive impact that we clearly know they can, often in spite of supportive environments. And so results from this literature review help to inform the development of the survey tool that will be circulating shortly, as well as our country case study interview tools. And we found that these tools now have, in part because of these findings, an increased focus on those environmental enablers to support women's leadership. And so this study really doesn't focus on the barriers that women face, because barriers are so well and clearly documented in the literature, but really on the impact that women leaders can have and on the type of environments that are needed to support that impact. Next slide.
Great, thank you, Anna. Oh, sorry, my cat is now being needy. All right, we'd now like to hand it over to our colleagues in Zambia, Madagascar, and Ethiopia to provide some reflections around women's leadership in their country context. So as mentioned, the study includes 3 in-depth country case studies, which comprise of a content analysis of RMNCAH-N and immunization policy and the role of women leaders in Ethiopia, Zambia, and Madagascar. So I would like to now hand it over to Dr. Cholwe Jacobs to start us off. So Cholwe, over to you.
Hey, good morning, good afternoon, wherever you are joining us from. Thank you so much for choosing to join this webinar. So I've been introduced, but I'll just quickly try and just highlight why I think this study really is important for Zambia, for a country like Zambia. Yeah, just to indicate that this is indeed a very important study for Zambia. Important in that, like many other countries, I think this has been highlighted, the pattern of underrepresentation of women in leadership positions, particularly in the health sector, is real. And this is not just for other countries, this is real for Zambia as well. And also, before I get to the point on why I think this study is very crucial and critical for a country like Zambia, I also want to highlight that while we see these patterns of underrepresentation of women in leadership positions, we must understand also that these patterns are limiting to women's influence, the talents that they hold, the skills, including the lived experiences that most women hold, particularly within reproductive, maternal, adolescent, child, including immunization programs. And I'm so glad that for this particular study, we are not looking at the gaps, nor are we looking at the barriers to these issues. These are known. In fact, they are becoming exhausting because we've heard them severally. What's critical about this study is that it's trying to explore and bring out the impact that women have within these programs. We are conversant of evidence increasingly highlighting the significant advantages and benefits of achieving gender parity in leadership roles. We are also aware that there are potential benefits and positive influence that women leaders can bring, particularly within these programs. And quickly, within my short time, I just want to give examples of existing evidence. For instance, evidence from low and middle income countries have indicated that women leaders have positive influence on development of maternal and healthcare policies and in mitigating health disparities. We also have evidence that has shown that female versus male decision makers exhibit greater commitment, particularly to immunization programs as well as RMNCAHN programs, such as procurement of contraceptives, an issue that impacts women's health and well-being. Unfortunately, we do not have specific evidence in Zambia. We do not have documented evidence demonstrating the impact that most of women that we know are leading and implementing these programs have within these programs and the spaces. And so we need to know, we need to understand the impact that women leaders have within these programs. We are so excited to be part of this project, to be part of this study. And we thank you so sincerely for selecting Zambia to showcase. This study is particularly important to Zambia and other low and middle income countries. We think that it will help change the narratives to begin focusing on what is working and how it is working. Try to see the impact that women, for most of the times, their efforts is masked or is undervalued. Findings from this study will certainly highlight the value and the impact women leaders in Zambia bring to RMNCAHN program, including immunization program, where most times may be undervalued. We also think that the study should be a catalyst to deliberate efforts. We need deliberate efforts to ensure equal representation of women in leadership positions for health programs, particularly for this one, the reproductive, maternal, newborn, adolescent, child health, and immunization. We think that the findings from this study should help highlight the impact that women have. Findings from this study should help us prioritize efforts for equal gender representation in leadership, and this should encourage organizational change in the health sector for gender equity in global health, especially that we are all aiming to universal health coverage. The role of women should certainly be highlighted. So thank you so much for this opportunity and looking forward to what we see from this study. Thank you.
Thank you very much, Chloe, for those reflections. I would now like to hand it over to Malanto Rabere for reflections from the Mozambique context. Over to you, Malanto.
Hi, my name is Malanto Rabere, and I work as an independent consultant from Madagascar. Thank you, Rosemary, for letting us be part of this study, and to the Johns Hopkins University and all the team, Gavi and GFF. Why is this study important for Madagascar context? We know so far Madagascar has qualitative and quantitative data available related to health status on reproductive, maternal, newborn, adolescent health and nutrition, and immunization. So let me just share a few indicators reflecting gender inequalities and challenges women and women leaders are continually facing. For example, our last demographic health survey 2021 stated that contraceptive prevalence changes with age group from 22% among women 15 to 19 to 50% among women 35 to 39 years, and 28% among women 45 to 49 years. Also, 41% of women and 29% of men believe that a man may be justified in beating his wife if, for example, she neglects her children, or she refuses to have sex with him, or even she burns the food, or if she argues with her husband. So those are common situations. UNFPA conducted a qualitative study in 2020 about the perception of women on the impact of the COVID-19 pandemic and the gender-based violence in Madagascar. And that states that 77% of women believe that the lockdown contributed to an increase in gender-based violence. So how can we bring transformative change in this typical situation? Our hypothesis is to bring women occupying a position which gives them influence and power over identifying priorities, providing strategic direction, allocating resources, and decision-making within the health sector. So here mainly in RMNCAH-N and immunization. Those women leaders will contribute, engage, and inspire the others, spread their impact from strategic high level to community-based interventions from national, central, and regional level. Women leaders could witness their experiences, success, and lessons learned, and contribute in decision-making process to fill existing gaps. Allow me to remember here what the General Secretary of United Nations, Mr. Ban Ki-moon, said at the Millennium Summit 2010. He said, we know what works to save women's and children's lives, and we know that women and children are critical to all the Millennium Development Goals. Today, we are witnessing the kind of leadership we have long needed. So in this quote, Mr. Ban Ki-moon was referring to women's leadership. Indeed, women leaders are impacting positively maternal and healthcare policies, strengthening health facilities, and reducing health inequalities. Gender parity in leadership has been shown to bring benefits, and we are convinced that all we need is to create environments where women leaders can effectively make an impact. Time is now to get evidence on women leaders' involvement in health policy and strategy development, which is effectively the aim of this study. So findings from this study will help many agents of change, such as implementing partners, donor, government, civil society, members of local women's network, community-based organizations in Madagascar, on how to efficiently invest in women's leadership, how to advance justice and equitable governance structures, how to enact positive change into women and children's health. All together, we can bring solutions in supporting women leaders in their sphere of influence, in providing strategic direction, allocating resources, making efficient decisions, bringing organizational shifts and normative change so that the country may increasingly improve its health status. So to some partners and stakeholders, women leaders, let us combine our efforts to bring this transformation in our respective countries and contribute to reaching universal health coverage. Thank you very much.
Great. Thank you very much, Malanto, for your reflections on women's leadership in Madagascar and your call to action as well within the country. I'd now like to hand it over to Swalia Abdul Kadir Mukhtar to talk about reflections on women's leadership in Ethiopia. So over to you, Swalia.
Okay, thank you, Rosemary. Good morning and good afternoon, everyone. I would like to say thank you for the Johns Hopkins University researchers for including my organization, International Institute for Primary Health Care. So on behalf of IPHC, I want to say thank you before starting my speech. So when I come to the impact of this study to Ethiopia, this study would bring significant effect on the overall look of women's leadership by unhiding what the women leaders' efforts were there historically. Because since we will include the 30 years journey of women leadership in Ethiopian health system, specifically for RMNCAH and immunization policy development, it is well known as the transitional government health policy. From that time onwards, it counts around 30 years. So starting from 1993 to 2023, there are several efforts seen inside our country. So I want to include the two governments of Ethiopia efforts putting for women in leadership. So let me start from the current Ethiopian government effort. The current Ethiopian government showed us considering a female president to lead the country and also for filling 50% of parliamentarian seats by female cabinets, and also is known by placing a woman leader as a minister for the Minister of Health Ethiopia. And also the current RMNCAH-N immunization directorate is also leading by known woman leader and pediatrician. So these efforts are also going to be coined and to be included as part of the historical document review of this study. So talking about the current government, let me come to the previous Ethiopian government efforts. The previous Ethiopian government efforts to place women in leadership are also known by developing the transitional health policy and also transitional women policy and population policy, and bringing different solutions, and also developing a sector development plan. It is known and also ranged from 1 to 4, HSDP 1 to 4. It covers 4 to 5 years under each development plan, and also the health sector transformation plan is also known and ranked from 1 to 2, and other supporting documents also been in place during the previous government. So when we talk about a woman leadership, I don't like to hide the efforts of health extension program policy also. In this policy, most of the implementers are, or 100% of implementers are female health workers, female frontline health workers. These health workers are right hand for all community members, especially living in the rural area, for the Ethiopian population to bring solution and services on maternal and child health services, and including vaccinations. So this study will cover this all efforts, collaborative efforts coming during the last 30 years period. So as a result of this collaborative efforts, there are several results seen and recognized in the country. For example, adolescent and youth health strategy were developed, and gender concepts are being integrated inside different health strategies. And MCH services shifted from being paid to free services. And in general, as an impact of these all collaborations, maternal mortality rate and child mortality rates are reduced significantly. So this study finally will leave recommendations for donors and investors to invest more in women leadership development areas, and also to engage women in different policy and strategy designing in the future, and also to make women leaders familiar for the new technologies, including AI. And in general, for Ethiopian women leaders, this study means beyond the paperwork. So it has several impact, and it has multiple advantage for a woman leadership to improve several things around RMNCH and immunization. Thanks so much, Rosemary. Over to you.
Great. Thank you so much, Salia, for your reflections on women's leadership in Ethiopia, and thinking about how we in this study are looking back into the past, from when policies were originally developed, and in Ethiopia, looking back about 30 years to think about what has been the role of women leaders in shaping policy in this spaces, and are we seeing any change or difference as a result. So next slide, please. So before we move into the question and answers, and if you do have questions, please make sure to input them into the Q&A box. We do have a call to action for you. So for those to participate in the study and to also circulate among your network, we have our English and French surveys are available to start, and we also will be having a Portuguese survey available tomorrow. And the eligibility criteria to take part in this work is that you must be an adult 18 years and older, a national of or primary citizenship from a sub-Saharan African country, lives and works in sub-Saharan Africa at least 80% of the time, currently or previously, and works in the space of reproductive, maternal, child, adolescent health and nutrition or immunization, and identifies as a leader, either male or female. So we do have a definition of leader here. How are we defining leader? So our definition is that in your current organization or institutional role, do you have influence over one or more of the following? How decisions are made, which priorities are identified, how funding is distributed, and the strategic direction of your organization or institution. If you answered yes to any of these questions, then we would consider yourself a leader in the space. And please do, if you're interested in taking part in this study, please use the QR code at the bottom. You may also email us directly about participating, and we can provide the email address in the webinar chat. And all survey respondents may enter a drawing to win a sponsorship for professional development opportunity, ideally related to leadership, up to $800 USD. So by participating in the study, we'll be, and if you opt in, we will be entered into this drawing. So please do, if you if qualify, take part in the study and distribute amongst your network, women and men leaders in your network. So with that, we will move on to the question and answer period. Let's see. So maybe we could also stop sharing the screen so we can see people when they're responding to different questions. Great, thank you. So please do use the question and answer function to answer. We have had a few questions come in. We have one from Workanesh Greta who states that they believe that gender mainstreaming is present in the majority of policies, strategies, plans, and programs, particularly in the health sector. And to be sure, engaging them in numerous leadership roles and providing them with opportunity is more important than just setting it down in the paper. How can the leadership of the health system be improved to include more women? So basically, what can we do to ensure and include more women within the health system? So if all of our speakers would like to, you can go ahead and turn your cameras on for the question and answer. And I saw, Anna, you have responded already in the Q&A, so I'm going to hand this over to you to start us off.
Yeah, sure. Happy to get us started. I mean, I think when we're talking about how can the leadership of the health system be improved to include more women, you know, one of the goals of this study is to move beyond representation and really focus on supporting women leaders. So once you have that representation, how can you retain them through supportive environments? And so that's something that this study also hopes to uncover, is what works for women in different contexts to support their leadership and the impacts that they want to have.
I'm just wondering if Cholwe, Melanto, or Swallow, if any of you would like to respond to this question.
And maybe, Rosemary, while we're waiting for other members of the team to come on, I could similarly respond to the tokenism question. So the same participant asked about tokenism, which I think comes down to representation as well. And tokenism was an interesting finding, or a part of our findings in the literature review, where we actually found that there's quite a bit of benefit to tokenism. And, you know, we don't want to say that that's enough, and we don't think that it is, but that really being able to see women in leadership roles increases other women and girls' aspirations. And that's that aspirations outcome that I was talking about on that previous slide. And so while we don't think it's enough, it is not inherently bad either.
Thanks, Anna. So maybe, Cholwe, can I hand it over to you for your reflections on this question?
Okay, yes. Just trying to make sure my video is on. Yeah, I think totally agree with Anna, but also I think this is a very important study, because I think this is the beginning, or this is an important starting point to respond to the question that has been posed. We think that evidence generation for most countries and for most health sector, I think there's some kind of unconsciousness in the way that we ensure that women attain these leadership positions. I think that by us trying to provide this evidence and show the gap, but also to demonstrate the impact that women have within the health sector, this is a very important starting point, because then, as I had stated earlier on, then we are able to see the value that the women bring in. So yeah, I think I would pause there and just highlight that we need to provide evidence. We need to demonstrate and show policymakers, to show people that in decision-making positions, to see that women ought to be part of the team and ought to be on the table.
Great, thank you, Cholwe. Melanto, Swalia, would you like to come in at all?
Yeah. Could you hear me?
Yes, we can hear you. Thank you.
Yeah, so I would like to add just information about the question asking how can leadership in health system be improved by integrating women? That's my understanding of the question. Effectively, that's a joint effort, and that's a continual effort from many implementers. So speaking about the government, the private sector, the civil society. So if I take, for example, the cases of Madagascar, I think we have the privilege to have a president who is very supportive of having women leaders among the member government, among his cabinet. And the effort is not only from the Ministry of Health, but a combined effort from the Ministry of Health and the Ministry of Population, who is leading the effort in terms of gender mainstreaming. So together, they do many advocacy efforts at a different level, directorates, even at the community-based interventions, at policy makers, and to get effectively women leaders having a position at this high level. So, besides, there should be a big training, information, and communication campaign at all levels, because people does not understand why. What is this difference between men and women? What is this kind of gender? Even the misconception in terms of gender is a big, big challenge. So I think this starts at different points, but together it will bring the effect at the right time. Yeah.
Thank you, Melanto. Swalia, over to you.
Okay, thank you. So coming to integrating or collaborating with male leadership, I personally believe there is no innate effect of women leadership and there is no innate effect of male leadership. Always we should work together. And when we talk about or bringing a woman leadership issue in a table, it doesn't mean it is only woman leadership should be there to improve the RMNCAHN immunization provisions throughout the countries. So, but recognizing the gap seen, and because there is imbalance between the health workforce or the proportion of health workforce and the women leaders, having women leaders in different places. So we should talk about, we should echo to bring more women leaders to the decision-making flow. Otherwise, male leaders should work together with female leaders. We don't have any effect. Thank you.
Great, thank you, Swalia. It's really great to hear perspectives, everyone's perspectives on how we can change or adapt the health system to improve representation of women leaders. There's an interesting question from Satya Meher on here on a personal level, on if you are facing any sort of disparity in your own team, what should we have to tackle it? How can we tackle it? What are the different ways to handle these situations? So we're seeing inequities in our own organizations, in our own teams. What are some strategies that we can do to address those? And I'm wondering, Charlotte and Sophia, if I can hand this question over to you to think about it from the context of Gavi and GFF, and if there's particularly anything that you've been doing in your own organizations to address inequities. So I maybe will hand it over to Charlotte, or Charlotte first, and then Sophia will next.
Sure, if you want. Yeah, I can go first, and I think it's a question we also reflect a lot on within GFF, but it's also more broadly reflected within the World Bank. Like first, like overall within the World Bank, there's a there's an overall human resources dashboard where you can go in and see like how many women are hired compared to how many men and at what level and all of that. So it sort of monitors the overall balance of our internal human resources. And it's a lot of things that we reflect on in our own recruitment processes as well, that we make sure it has a diversity across various regions and genders and things like that. That is obviously key in our internal processes. And then I think it's one of the things we do particular with our partners and DFF as well, is that we've set up this specific program. We call it the Greater Leaders, but it's a program which is more, it is destined to women, upcoming leaders or current leaders, but more as I'd call it probably a coaching program, but specifically targeted for women. So they get a sort of a safe space to speak of what are some of the bottlenecks of being a woman in what is clearly, at least when we look at the data, which is clearly a male-dominated environment. So I think that helps. Like there's a lot of exchange as well amongst participants to address and address some of these issues and exchange experiences. So that is one of the ways that we go about it with our partner countries as well. I'll stop there and leave it to and over to Sophia.
Sure, thank you, Charlotte. So in Gavi, we also have I think several ways to manage these, recognizing that actually in this field we have really a lot of women. But for example, there is internal policies that have been developed. There is internal gender technical working groups, not only to look at the program policy level, but internally, specifically with representation from all departments across the organization. Also, there are safe places also for report and discussion, even with the senior leadership, and also some kind of additional tools that can provide this information and try to tackle, of course, challenges that are reported across the organization. So there are a couple of them, some also work in progress, but this is some of the examples that we have at Gavi. Over to you, Rosemary.
Thanks, Sophia and Charlotte, for those useful examples. We only have a couple minutes left, and I'm just wondering if any of our other panelists would like to reflect on this particular questions of what we can do in our own organizations and our own teams to address gender and other inequities. I don't see anybody turning their cameras on or their...
Actually, Rosemary, I think this is a good question, but can you repeat it one more time?
Yes. What can we do in our own organizations, our own teams, to address gender and other inequities, particularly within leadership?
When I think about maybe I'll even highlight our leadership, Rosemary, because I think we try to do this. I think that some of the ways that we can tackle this is through radical transparency around our hiring practices, around pay equity, around those things that are relevant for people's motivation and career aspirations, right? The things that we can do, right? I think there are ways where we can dismantle harmful narratives in leadership, right, around conflict, turning this around and saying, actually, conflict can be really powerful and it can help us to grow. And so I think, the ways that we can lead within our organizations is really by first assessing what are those things that don't work for us, that are inherently patriarchal, that are really coming from these organizational norms and systems and structures, and then just identifying alternate ways of doing this, right? We don't have to lead in ways that that leaders have always led, right? It doesn't have to look the same way. And in fact, it can look radically different, and that this can be really powerful and transformative.
Mm-hmm. And I guess just a plug for those of you that are attending the Women Lift conference in Tanzania, our team will also be there, and we have a session that really looks at gender transformative leadership that thinks about how to challenge some of these things. So if you are going to be in that conference at the beginning of April next month in Tanzania, we would love to see you there, connect, and if you can come, please do come to that session. Swalia, I saw you put your camera on, so I'm going to hand it over to you for our last word in response to this question. So please go ahead.
Okay, thank you, Rosemary. Actually, Anna already said it, but what I want to say here is, if we are talking about a team is a combination of different peoples with complementary ability. So a leader should know what quality each of the team members have and work, and to create harmony between team members. The capacity and the team members' quality should be identified earlier by the leader of the team. So working on that might help to ensure equity within the team members.
Great, thank you very much for that. Really useful tools. We are at time, so we would like to thank everybody for joining us today. And there's some additional questions I see that have come in. I'm sorry we haven't had a chance to answer them all. I should say, Lillian and Miriam, your questions is exactly what we want to address in this study. We want to think about how can we improve women leaders in the health sector, or like get more women leaders, and also ensure that the contributions of women are not only recognized, but also valued equally. A lot of that question is around the enabling environment factor, right? What are factors in organizations and environments to ensure women leaders are able to thrive and are able to have impact? So thank you all for joining us today. Please do stay in touch. Thank you for everyone who shared their LinkedIn. I have connected with all of you. Also shared my LinkedIn in the chat, and look forward to addressing these questions more. If you are going to be at the Women Lift conference, please do come to the session. Come say hi. We'd really love to network with all of you. This has been recorded. We will upload it and share it with everybody who registered as well. So we will be sharing the recording with you. Thank you all for joining, and we really look forward to continuing these discussions with you further.